Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Having PTSD symptoms, Tetris Video Game May help. A BMC study on healthcare workers reveals. A single treatment session, which includes the video game Tetris, may help reducing the symptoms of post-traumatic stress disorder. This has been shown in a new study carried out with healthcare professionals working during the COVID-19 pandemic. The study, led by researchers at Uppsala University, is published in BMC Medicine. It is possible to reduce the frequency of unpleasant and intrusive memories of trauma and thereby also alleviate other PTSD symptoms. With just one guided treatment session, we saw positive effects that persisted after 5 weeks and even 6 months after treatment. Trauma can affect anyone. If this effect can be achieved with an everyday tool that includes video gaming, it could be an accessible way to help many people, explains Emily Holmes, professor at Uppsala University, who led the study. In the current study, the researchers focused on getting rid of flashbacks. By replacing intrusive memories using a visual task, other PTSD symptoms can also be reduced. The treatment is based on what is known as mental rotation, which lies at the heart of Tetris. When you look at an object from one angle, you can imagine what it would look like if it were rotated to a different position and could be seen from a different angle. The study involved 164 participants. All participants monitored their intrusive memories of trauma for a week. After that, they were randomized to one of the two conditions. Half the group were asked to play Tetris with mental rotation. The other half, the control group, was given a non-visual task, listening to the radio. All participants kept a diary about their flashbacks. At the start of the study, participants were experiencing an average of 15 flashbacks a week. At a 5-week follow-up, participants in the control group had an average of 5 episodes a week, but those in the gaming group had an average of just 1. At a follow-up 6 months after treatment, participants in the gaming group had less severe symptoms of PTSD. In an assessment using a recognized questionnaire, often used to assess all PTSD symptoms, the gaming group experienced around half as many problems as the control group. It was surprising to us that the treatment method was so effective and that the improvement in symptoms lasted for 6 months. I realized that it may seem unlikely that such a short intervention, which includes video games but doesn't include an in-depth discussion of trauma with a therapist, could help. But the study provides scientifically controlled evidence that a single guided digital treatment session can reduce the number of intrusive memories and that it can be used safely by participants, said Emily Holmes. My vision is that one day we will be able to provide a tool for people such as healthcare professionals after traumatic events to help prevent and treat early PTSD symptoms. That is a cognitive vaccine in a similar way that we currently vaccinate against some infectious physical diseases, explains Holmes. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.